I am so excited to welcome you not only to Jacksonville, but to the launching of the podcast called The Covenant, more specifically, the Sistah Covenant. And yes, I did say sister. What is the covenant, the Sistah Covenant? It is a circle of friends, my friends for 20, 30, 40 plus years, your friends, all of our friends, coming together in a safe space at a time such as this. We as women of color, we are counted on to nurture our families, our children, our significant others, our spouses, our community, our corporate boardrooms, and everything in between. But who fills our cup? I think about flying, and when we get ready to take off, what is said to us first? Put your oxygen mask on first before you can assist others. And that exactly is what the Sistah Covenant is all about. A safe space to encourage, to listen, to cry a little, laugh a lot, but most important, to empower and to fill our cup. Good morning. Great Sunday morning. And welcome to the Sistah Covenant. We are firmly in January of 2022. My goodness. And we have started out with a bang. We've had some powerful conversations with some empowering women. And today will be part one of a two-part series of caring for aging parents, which affects all of us at some point in time, caring for a loved one who is advancing in age. But before we get there, I want to thank you for supporting us over these last year plus, and buying and purchasing your beautiful Sistah Covenant apparel. If you've not had an opportunity, or if you need to refresh, you can still do that by visiting our website. And as you know, every time you spend $100 or more, we donate $10 on your behalf directly to UNCF. Because a mind is a terrible thing to waste. We are still firmly in the middle of this pandemic, COVID-19, the Omicron variant, or whichever variant that we may face. We know we're going to meet this moment and we're going to get beyond it, but we got to continue to help these students pursue their higher education. So consider purchasing your merchandise. And again, every $100, 10 of those dollars goes directly to UNCF. We have embarked on a campaign back in September. 50 of my powerful friends came together and they told us why they got vaccinated. So the campaign of Together We Win, Powerful Women Get Vaccinated is still alive and well, because as we just stated, it is incumbent upon us to get vaccinated, get boosted, and encourage all of those family members, friends, and all the folks we love, and even those we don't, to join us. So we encourage you to join us in the 25 challenge. Post a picture or a video on why you got vaccinated using the hashtags Powerful Women Get Vaccinated. Together we win. And tag at the Sistah Covenant and 3 of your friends. It's just that simple. Now, I want to invite you to watch this PSA of some of my powerful friends who chose to get vaccinated.
My name is Dr. Courtney Owens. I chose to get vaccinated because as an emergency medicine physician, I've had the unfortunate responsibility of holding the hand of a young, healthy, 30-year-old man as he took his last breath and died of COVID-19. I then had to tell his own mother over the phone that she would never get to hold his hand again. This death and thousands of others could have easily been prevented with vaccinations. Vaccinations are the one thing that have been proven, along with masking and social distancing, to be safe and to be effective at preventing COVID-19. Take responsibility for yourself, for your family, and for your community. Get vaccinated. Strong women get vaccinated. Together, we can.
I'm Dr. Cheryl Holder. I'm an internist, a caregiver of a 92-year-old. I teach medical students. I care for patients with immunodeficiency conditions like HIV and AIDS. I care about the community. I'm a scientist. I believe the science. I trust the science. Vaccines work. Vaccines are safe and effective. Vaccines protect you from severe disease and death. Get vaccinated. Powerful women get vaccinated. Together, we win.
Hi, I'm Dr. Lynetta Bronte Hall, and I believe in the science. And because I believe in the science, I got vaccinated. Because I believe in the science, I wanted to make sure that the patient population that I work with sickle cell disease, they're very vulnerable, that I protect them and that I also protect myself and my family. So powerful women get vaccinated and together we win.
Hello, I'm Dr. Kim Barbell Johnson. I'm a family physician and a clinical research scientist. As a physician and a scientist, I chose to get vaccinated because I understood the science enough to extinguish the politics from this pandemic. I also chose to improve my odds of survival in this pandemic for my children, for my parents, and my community. Powerful women get vaccinated. Together, we win.
Hello, my name is Lorraine Polite Clark. I decided to get vaccinated because as a wife, as a mother, and as someone with a whole host of folks who expect me to be healthy, they also rely on me to make prudent health care choices. Powerful women get vaccinated. Together we win.
My name is Dr. Anita Pettaway Tyler, and I am the medical contributor for the awesome Sistah Covenant. I am here to tell you that I would like to encourage you to remain vigilant. We all must. COVID-19 is running rampant in our communities, and so we must do something. The something is prevention. The way to prevent COVID-19 is, number one, to get a vaccination. Millions of people have been vaccinated to date, and the vaccine is safe and effective. The other thing that we can do is to make sure that we're masking. We should wear our mask indoors and also outdoors in crowds where the vaccination status is unknown. And lastly, we can make sure that we continue to practice social distancing. We must do this to prevent COVID-19. We can do this, and together we win. Thank you.
Wow, that was powerful. So now we're going to get straight away at it. Now, I would like to bring our medical contributor, Dr. Anita, and to the Sistah Covenant platform. Dr. Anita.
Hi there.
Good morning. Good morning.
Good morning. How are you?
Doing well, doing well. Well, we know you, Dr. Anita, as just that, our medical contributor for the Sistah Covenant. We know you're an internal medicine doctor in South Florida, But this morning, we're talking to you as another hat that you wear, most precious hat, that one as a daughter and a caregiver of your beautiful 78-year-old mother. Talk to us about that, Dr. Anita.
Sure. So thank you for the opportunity to do so. I'll just so I got a little permission, I told my mom she was going to be the start because I'm going to be talking about her today. It's interesting when you become a caregiver, your life goes on and your parents are doing fine. And then there's an event or something that happens where they're unable to care for themselves the same way. And what I've decided, with the help of my sister as well, to make sure that we honor our mother in trying to keep her as independent as possible, whatever her wishes and desires are, making sure we fulfill those, and then getting help. What I've recognized most recently, is that I need to start looking for some help. Now that becomes a little difficult with COVID. So bringing somebody into the home can be a little bit more complicated. And then one of the other things I think I've learned during this time is that the insurance companies have resources for their members. So there's a food service because she's on a special diet, special meal. There's a food service that delivers some of the food items that she can eat, which makes it easier for us. My sister suggested that we do a service that prepackages medicines. So we're not actually having to count out medicines to every day. And mom can kind of do some of that on her own, but we realize that that's becoming more complicated. So we're going to try to get a service to do that. And some of the insurance companies, and I know this from being a primary care doctor, actually offer buddies that can actually help their members with services. So it's important from my standpoint to see what resources I have to help me, because it's difficult, not easy to take care of your mom or your dad. But it's my pleasure. That's what I would like to say, that it's actually my pleasure to take care of my mother. I wouldn't be who I am today without her. So caregiving is not easy, though. It's a blessing to have to do it, though.
Dr. Anita, how are you balancing? How are you balancing your home, your practice, especially during these challenging times already with the pandemic? And I know some of your staff is not, they are being faced real time with COVID themselves. So how are you balancing being that caregiver, keeping your mother and her quality of life? I really am happy to hear about some of the resources, because I didn't know about the buddy and I didn't know about some of the resources that the insurance companies give, because that helps. But
Absolutely.
How are you balancing, and what are you doing for yourself to keep yourself sane?
Okay. Well, let me first say it's not easy. I think you just have to prioritize and learn to say no. There's some things I just can't do right now. And I've just reached out to some of those that I can't do the things that I have maybe promised to do, and tell them that I can't. Putting my mom first, taking some time the other day when she was hospitalized. I actually told her that I was going to take a minute to go get my nails done, just to take a minute for myself. And so it's important to remember self-care. And of course, without prayer and support of friends and family, the love of Christ, just depending and trusting on Him. I mean, that's our source. That's where we go to in a time of need. So it's not easy. You just have to do it. You balance. And then what helps me too, I have to give credit to my husband and my daughter, making sure that they understand and are engaged in the process has been important. They love their mother-in-law and grandma. So my daughter was lifting up the walker up the stairs the other day. And I mean, it takes and I think the whole family to help. And I have a sister that's engaged as well. With her and her family, they help. So it's not easy, but you just find a way to do it. You have to prioritize. If I had to say anything, it's just prioritizing.
Well, thank you, Anita. Well, we want you to know that we are praying for you. We
Thank
are
you.
certainly praying for total restoration of health for your beautiful mom.
Amen.
And we just know you to be the beautiful woman that you are.
Thank you,
And
Pat. You too.
so thank you. And you just keep keeping your head up and that smile. And we know all will be well.
Absolutely. Thank you for the opportunity to share because it was therapeutic.
Well, we got your back, girl.
I
So
know that too.
we got your back. So thank you. Thank you. Kisses to you.
Thank you too. Have a great day.
Bye.
Bye-bye.
Example of that. I am super excited to share a conversation that I had with a dear new friend of mine, Dr. Evelyn Ivy Maughy. Dr. Ivy is an internal medicine doc, but also a geriatric doctor in Annapolis, Maryland. And her focus is on age-friendly care and taking care of our aging parents well. Dr. Ivy, join me in the Sistah Covenant studio.
Thank you so much for having me, Pat. I'm very excited to be here and take part in this very important conversation.
Well, we are excited. And as we begin this new year, you hear of folks beginning resolutions and putting forth what they want to see positive in our lives. And we have a lot of negativity. We talk all the time. You hear the numbers of COVID-19 and now the Omicron virus or Omicron variant raging across our country. But we still have life going on and we still have some of the same journey that we had prior to COVID. And COVID has kind of eclipsed our lives in a lot of ways, but we still have to live life and we're trying to live it well. So when we get to talking about our parents, and in particular, our aging parents, and I'll speak for myself at this age, wanting to make sure that our parents are living well, and your focus is age-friendly care. Age-friendly care. So tell us about that. What exactly does that mean, age-friendly care?
So that's an excellent question and a good place to start our conversation. And age-friendly care is age for older adults that focuses on aligning the healthcare that we are providing to older adults with their values, their preferences, and their goals. And in age-friendly care, we encompass the principles of good geriatrics care, evidence-based geriatrics care in 4 M's. The first one is matters most. Then we have medications, mobility, and mentation. And these 4 M's are a catchy way of reminding healthcare workers across the continuum of care to focus on the things that impact the health of older adults and make sure that they're paying attention, close attention to those important pillars of healthcare for an aging person. So the first M is matters most. And the question we should be asking our older adults when they come into our care is, what matters most to you? And when we ask that question, we're hoping that the patient we're talking to and their family member or caregiver will be able to tell us the principles and the values and the preferences that this older adult has. For example, they might say, I want to be home in my own home for as long as possible, and I don't want to be placed in a nursing home. So now we know that what matters most to this older person is to be home for as long as possible, to be independent as long as possible, and as far as possible, not to be institutionalized. And so we want to hear from our older adults, what matters to you? Most people, when asked this question, will talk to us about family, relationships, and very rarely will people talk about things, material things or possessions. Most people discuss the important relationships they have in their lives with their spouses, significant others, children, grandchildren, and even great-grandchildren, depending on the older adult that you're talking to. So that is what matters most to an older adult. And then we talk about mentation. Mentation is very important. In order for people to make decisions and to live well, they have to be in their right mind in every different domain. So emotionally healthy and organically not have any disease in their brain. And so we have to think about the older person's mentation and consider how that affects what matters most to them, how it affects their mobility, and how any medications we're giving them is affecting their mentation. And under mentation, we think about 3 Ds. We think about dementia, which is a big, big problem in older adults. We think about depression, and we think about delirium. And these 3 Ds can coexist in the same patient, or they can have only one of them. And so it's important, again, across the continuum of care, to think about an older adult's mentation and pay close attention to depression, dementia, and delirium. Then the other M is mobility. And mobility is so important because for older adults to remain independent and to live well and thrive in their communities, they need to be functional. They need to be able to move from one place to another. And therefore, we should be looking at an older person and asking ourselves if we are optimizing their mentation and their medications so that they do not negatively impact their mobility. We know that when an older adult falls and God forbid they have a fracture, that is usually the beginning of a process of healing. And sometimes it is because of a fall and a fracture that people lose their independence, lose their functionality, and end up in institutionalized because of a problem with their mobility. And so this M is very important to older adults. And then finally, we have medications. And we can talk about medications all afternoon. Medications are very important because they impact mentation, they impact mobility, and if they do that, then they will have an impact on what matters most to people. And therefore, as older adults, age, they may have multiple medical conditions for which they are prescribed different medications. Different specialties will recommend specific medications that are known to treat the condition that the person has well. So for example, if an older adult has heart failure, they may end up with 3 or 4 medications that their cardiologist is recommending because those medications have been shown to improve the quality of life, the longevity for people with heart failure. But what that leads to is people taking lots of pills, and medications have side effects. Medications also have what we call drug interactions, which means that the fact that you're taking one medication and another medication, they may not work well in your body. They may have reactions. They may cause more side effects or adverse effects. And therefore, once again, as healthcare providers, we need to look at our patients' medications and ask ourselves, are these medications necessary? Are we giving the right dose for the right duration, for the right indication? Are they working against each other? Are they putting my patient's mentation or mobility at risk? Sometimes medications can cause people to be groggy, have gait instability, increase their fall risk. And then now they fall and they have a fracture and they have to go to a rehab or skilled nursing facility. And there we are impacting all of the M's in a patient's life. And so this is why age-friendly care has been presented as a paradigm and a lens through which all of us across a continuum of care are viewing the services we provide, the care we provide for older adults, so that we can make sure that we uphold what matters most to our older patients.
That was a lot, Dr. Ivy. That was a lot of good information. So let's unpack a little bit of it if we could. When we talk about older adults, first thing, what are we considering older? What's that number like?
In the US, the definition for an older adult in the geriatrics field is anyone who is 65 years or older.
Okay.
So that's the age group we're talking about.
Okay. Well, I have just a little bit before I'm in that age group. But in all sincerity, when I'm talking to my girlfriends, and we're talking about my mom and my father have since passed on, but I was in that group of a caregiver, if you will, while caring for my family, my younger two sons at the time. So how do we navigate or help our aging parents navigate this this natural progression of life, which is aging, and doing it in an age-friendly way, but obviously doing it as we are trying to live life as well and help them enjoy life and quality of life. How do we best help navigate all of that?
Well, Pat, that is a loaded question, one that I think we can break down into a few segments so that we can get some good details out there. So one, I think you described the situation that many caregivers find themselves in. And that is, many caregivers have been described, especially women, as belonging to a sandwich generation, where they're sandwiched between taking care for older parents, aging parents, and their children, who are usually teens or young adults that still need their parents. And so these women find themselves caught between these family members that need their attention and their care at the same time. And thank God women are multitaskers, right? So how do we help people do this? I want to start by saying that one of the things people always think is that all caregivers are women. But actually, 60% of caregivers are women. And so there is a 40% population of caregivers that is male, and they too are going through this exact conundrum. The other thing is to also ask ourselves, who is a caregiver and what are they doing? And so a caregiver is somebody who is supporting another person, whether it's to make healthcare decisions, whether it's from a homemaking front, whether it's financially, and they are doing this for this person voluntarily, and they don't receive any compensation for it. And so that's a caregiver, and there are different levels and forms of caregiving. You know, there are as many caregiving situations as there are people and families. So I think with those sort of few definitions, we can now go into more detail about how can we provide support for our aging parents. And in thinking about this, I think we should consider it from a family level, from the community side, and then look at it from the healthcare side. And I think that for all of us, as we are aging, I think it's important for people to embrace that and to say, you know, I am 65 years older, as old now, I am 70 years old. I do need to just embrace this and know that this is where I am in my life. And why is that important? Because it gives you a mental and emotional framework to think about how you want to live out the remaining years of your life. And so when we look at life expectancy in the United States, from birth, people's life expectancy is about maybe 78, 79 years old. And then as you get to 65, depending on what has been going on in your life and your genetics and outlook, there might be another 18 to 20 years of your life left. And so the question is, how do I live this latter part of my life in a healthy and productive way? And one of the ways we can address these issues with our parents is to have gentle but focused and timely, intentional conversations with our parents and say, you know, now that you are 70 years old, I think we need to talk about your health care, you know, and finding out from your parents who is their primary care physician, how do they get in touch with them, what medications are they taking, what pharmacy are they getting those medications from, are they mailed in, do they have to go and pick them up, you know, what's going on with my parents' medications. And then also figuring out who the specialists that provide care for your loved ones are. Where are they located? What is the best way to get in touch with them? What condition are they treating? And we need to do this intentionally and early, because what happens is a crisis takes place, and then now we have to figure it out in the middle of a crisis. It's when they fell, you know, unfortunately, they have a hip fracture. Now they've ended up in the hospital, and I'm on this end asking, what medications does your mom take? And now nobody can answer the question. What pharmacy do they go to? I need to figure it out. Who is the primary care provider? You know, oh, I don't know. You know, mom was handling all of this by herself until now. So I think we have to open up that conversation with our older parents and really, you know, start to put this information together. I think the other thing that I would like to put a plug in for is advanced care planning. This is very important for all of us, and especially for those of us over the age of 65. It really is important to sit with your family and let them know what your wishes were. God forbid if you are in a serious health crisis and you could not be able to speak for yourself, you want to have told your family and your loved ones what choices and options you would like. It's also in that space that you can talk about who would be your healthcare power of attorney. Is it one of your children? Is it 3 of them in consensus? You know, who is it? So the default setting, obviously, if somebody is married, is your spouse. And if for, you know, whatever reason your spouse can't speak or they would not want to make decisions by themselves, they might say, well, we want this particular child to be involved in decision making, or, you know, however your family wants to structure that. And I could not emphasize this enough, because again, when crisis happens, then people are having very difficult conversations in the middle of a stressful situation outside the ICU, which is really not the time to be trying to make those important decisions. Who decides, if mom should have this major surgical procedure or not have it? Or, should she go to a rehab? Or should we try and do this at home? So I think that having those conversations when people are well, and that they can be able to tell you, your parents can be able to tell you expressly what they want and who they want involved in their decision making as far as healthcare is concerned, I think is very important. And those things are sort of some of the pillars around which you can then be able to assist your parents. I think knowing where they are in their health status, knowing who their healthcare providers are, knowing their pharmacy, having an advance directive, having a healthcare power of attorney assigned, those things are going to help your parents, and they're going to help you when there is a health crisis, because then you're not scrambling and trying to figure out what to do. And then when those kind of pillars are in place, then you are better positioned to assist. I think it's important also to listen carefully to what your parents are saying about their health conditions, And I was thinking about this today. Sometimes we see our parents decline, but we excuse it or we find a way of explaining it. But it should make us come to the table and say, hey, what's going on? So for example, if, your dad was always able to get in the car, drive, go to the park and take a walk and come back home. And then at some point you realize he doesn't actually do that anymore. He's just walking in the neighborhood, a couple of, houses down the street and coming back. And then over time, he's not even doing that anymore. Now he's just sitting on the porch. And, he just says, well, I'm just a little more tired. I don't really feel like going. And those are clues and indications that this person is probably not doing as well as they were before. And we probably need to get involved and find out what's happening. Are they short of breath? Are they in pain? Can they not see well enough to do the things they need to do to drive or to walk on their own? What is happening? And I think we need to, open our eyes and look and look for clues as to how well our parents are doing versus assuming that they are managing because they don't say anything to you. They're not coming for help. They probably won't. They don't. Many older people say, I don't want to be a burden on my children. And so I think as their children, we may also have to open our eyes to look for signs that our parents are not doing well and start to think about how we can assist in a very specific and intentional way, so that we can help them as they move along in their age. So I'll stop there and see if there's something else we need to address.
You've said a lot, Dr. Ivy, and I agree. I concur. My husband and I had that conversation you talked about with our two young adult sons, 21 and 23, just this holiday, because we had not changed our will since they were young. And so everything in the will was about guardianship for them. And, it was a 22-page will, and now it's about a 4-page will, and it has a medical directive attached to it and what our wishes are around that if, one of the other of us are not here to guide that. So what you have said is just spot on. I want to, though, before we go on to talk about maybe some of the specifics, what about those parents that are independent, living in another city, in another state? So you want to honor the wishes of them maintaining what matters most, that one of those key pillars, those M's we just talked about, you want to maintain that. But when do you start kind of saying, we got to talk about this. We really need to make some decisions on how some of this may change. Have you seen that kind of scenario start to play out in your practice?
Oh, absolutely. So my practice is in the hospital and I take care of hospitalized older adults. And so I see this a lot in my daily work. We will have older adults who are admitted to the hospital for any number of medical reasons who are alone in the state of Maryland, and their children are spread out in different states in this country, and they're thriving and doing well out there. And as far as they know, their parent is doing well. And the usual is that the parents settled here, brought their children up here in this state, and then the children moved away and left the parents at home. And then one of the parents has now passed on. And so we have now a sort of an orphaned older adult. And in that instance, what happens is the out of state child or children are usually not very familiar with what's going on with their parents' life. And so they are usually very involved friends and neighbors who may be the ones that call 911 to bring this person into the hospital. And it's usually a stressful situation for those out of state family members when they come, because they don't find the parent they knew 2 or 3 years ago. They find a frail older person who is not doing as well as they thought they were. And they say, we talk on the phone. They never said anything was going wrong. But again, many patients will say to us, I don't want to be a burden to my children. I know they have lives. They're having to bring up their children. They're doing ABCD. So they keep their health concerns and their aging concerns to themselves until a crisis happens. And so I think the onus is on people to sort of bring it up. There's never, now is the time to bring it up and just say, Mom, how are you really doing? Dad, how are you really doing? Make that trip across the state, come and see them. Start to make plans for, somebody to move to somebody's, closer to somebody else, because one of these days, unfortunately, a health crisis occurs and this vulnerable person is by themselves, and their family is not able to intervene. And so I think that people need to have the conversation, and I think we try not to because we don't want to step on anybody's toes, and we do want to respect and honor their independence. But at the same time, I think if you bring it up, then the fear that they are interrupting or interfering with your life out there and all of what you need to do will dissipate. And once you open up that conversation, you'll find that perhaps your parents are a little more receptive and willing to have the conversation because they are afraid. They're by themselves, and they do want somebody to help. They just haven't said anything.
So, Dr. Ivy, in our community, and I'll just say in communities of color, there is maybe even a little hesitation around the conversation around facilities. And you talked a little bit about it earlier. Help us navigate that conversation. Have you seen, and I know you're in the hospital setting, but parents or even their adult children feeling like either I want you to come live with me, or the parents saying, no, I want my independence. I'll go into, a managed care facility or an independent living facility, but the adult child feeling some guilt over that. I find that is some of the conversations that I'm having with some of my friends, where their parent is either saying, no, I don't want to come live with you, or the family is saying, I don't know how this dynamic is going to work, and we need to talk about this. Can you tell us a little bit about what it is you're seeing around that conversation?
Yeah, I think, I'm seeing, everything you're talking about is very real and present, again, on a daily basis in my work. And I think that aging is a very complex phenomenon. It's fraught with different confounding factors, if you will, because it's a natural process. This is what it is in life, but there's also your health matters as you age. And so the healthier you are, the more independent you can be, and the longer you can be independent. And financial, money matters a lot when it comes to those decisions. And I will tell you that it's probably the key factor in determining whether somebody can remain in the community versus be institutionalized sometimes. So what do I mean by that? If as people age and they decide to downsize on their homes and move into a 55 and older community, or 65 and older community, or an assisted living facility, that's determined by their financial well-being. You have to have good financial resources to be able to access those kinds of places to live in the community, where people live well. They play golf and they have all these activities, and the community is designed to enable people who've retired and are still healthy and are independent to live well and to have a new social connections with other people like them. And so they're not lonely out there by themselves. But that requires significant financial resources. And so in maybe, in minority communities, but not just the minorities, there are also, our Caucasian families where everybody doesn't have resources to do that. So what next? And then comes a conversation you're talking about, who lives with mom or dad, and sometimes people do end up living with a family member because there was no other way to do this. And again, resources matter. And so I think that we cannot prepare for everything in life, but it's important as you approach these years, think about how am I preparing myself financially for my aging process? How are our parents preparing themselves financially for their aging process? So I've had examples of families where people had the foresight and the resources to think about that, and so they moved out of a 2-story building and went into a one level living, accessible home, because they wanted to age in place, as we say. They wanted to grow old together at home, and they didn't want to have to move again. And so they planned that in the future. Not everybody may be able to do that, but if you can, those are some of the things to consider going forward, is saying, should our parents move into a different community, into a different kind of home? Do they have the resources to live in an assisted living facility? What kind of medical insurance do they have? What kind of long-term care insurance do they have? Read the fine print of when and how you can access this insurance benefits if you do have them. But again, it comes down to resources. And I think I'm repeating myself, but this is what it is, because the more resources you have financially, the more options you have open to where your parents are going to live and how well they're going to live, and whether they can have caregivers at home or not, or whether they have to live with a sibling or not. I think that the guilt around sort of putting your parents away or your parent away in a nursing home is real. And it's very unfortunate, when some of these things happen and family members are working, or they themselves have health issues and they cannot provide perhaps the level of care that their aging parent requires. And so the option left to them is, a nursing facility or an assisted living facility. And I think that, again, it's to have a conversation that says, what can we do as a family realistically, given all that's going on in everybody's life? And if that's the option that's left, then you sit together and choose a facility that you hope will meet the needs of your older parent, and see how that goes. But it's a difficult conversation, and there's a myriad of factors to consider, and there's no one size fits all. Every family will have to navigate this based on their resources, their health conditions, the health conditions of the person that they're dealing with, the insurance that they have, and all of those things factor in deciding the next best place to take care of an aging parent.
I mean, real time. I lived everything you just said. And fortunately, and I will say, because God was in that conversation, my parents moved from a different city before my father got ill. But literally, they moved, and within a month of them moving to the city I'm living in, he got very ill and ultimately never came home. And my mom had the foresight, and they were very fortunate and blessed, I will say, that she was able to, because she had been his caregiver for many years, as he had been a paraplegic from a stroke some 20 years earlier, to buy a home on the same property where the nursing facility was, because she could no longer take care of him. And then, to the point you made, when he passed on, she still had that home, but then she came to live with my sister and myself. So we made the decision that was necessary at the time. But I have friends right now with us living in this pandemic that may have had that in place, but now, since the pandemic, they've made some different choices because of them feeling it's unsafe. So you're right. There is no one size fits all. It's very challenging, and it is a conversation. And that's what I'm going to take away from today. You got to have the conversations. You may not have all the endless resources, but you got to start with the conversation.
Absolutely. And you make a good point. I think COVID-19, the pandemic, has really, caused an upheaval in our society, but it has opened our eyes to how stretched these facilities are. And I think, in my training, in my geriatrics training, I did have to work, see patients in an assisted living facility, in a long-term care nursing home, in a dementia unit, in a subacute rehab facility. And I can tell you that, the staffing in no way, shape, or form matches the level of demand that these healthcare providers have to give. And so while we cannot excuse, poor care or abusive care, we also have to really admit that with the pandemic, it revealed the underbelly of something we all knew, but because they were tucked away and hidden away, we didn't have to see it every day. COVID-19 unveiled all of that, and I think it has made a lot of people rethink their plans for how they're going to age, how their parents are going to age, where they're going to age, because they now know that, they can go into a nursing home does not apply, or may not be a favorable choice, given how stretched those healthcare providers are. Those facilities are stretched to the limit, and they are not staffed to be able to meet all of the demands of all of the people that they care for on a daily basis. And we just have to admit that and accept that, and hope that, in the policymaking world, that we are going to see changes in that direction, because it's a tough situation. There are people for whom these facilities are the only place they can go. And so we do have to, see an improvement in care. But I think families are also now going to think long and hard before they send a family member there, and consider taking care of them at home. And I think more and more people are going to go towards, more and more home-based care, which is going to be in some ways good, but in some other ways may increase, the stress on caregivers, which is something very real that we need to also pay attention to.
So, Dr. Ivy, as we wind down this conversation, but you're coming back in 2 weeks so we can really drill down to some of the memory loss details and conversations that, again, are so prevalent right now with aging parents. But how do we help our parents or our loved ones, not just parents, age well? And what I mean specifically, I remember with my mother, she, I saw it happening and she would depend on me a little bit more, but my, how I would handle that is say, no, you tell me, or you do this. And where I was coming from with that is if she could do whatever it is she could do, whether, and you talked about walking the block, and now you're not walking the block, you're now sitting on the porch. Can you walk the block or can you go down 2 houses? Whatever it is you can get them to do, how do we get them to live well and to do that crossword puzzle? And they may not be able to complete the whole crossword puzzle or the whole puzzle, but let me help you do that. Does this make sense? How do we navigate or help them have the best quality life they can as long as they can?
Yeah. I think we have to be intentional about it. I think one of the things I've learned from listening to patients tell me they don't want to be a bother, they don't want to be a burden. They see the needs that their children and their grandchildren have, and they don't want to add to the plate of needs that need to be met by their families. I think we have to be intentional. We have to say, I'm going to every, whatever Saturday, I'm going to take my mom out. We're going to go walk in the park. I'm going to get some exercise. She's going to get some exercise. We're going to get some fresh air, some quality time together. And then I'm going to go and do life with my children after that, So you sort of have to be intentional and specific, be specific, does mom need medications picked up? Is it grocery shopping that we can now do for her, and organize that around your lives? And so, I have seen my husband's family, there are 3 brothers, and they decide, who's going to do grocery shopping for mom this weekend. And so, they go over there, they get the list. She may or may not come with them, and they go and do grocery shopping and bring it home. And that's, that's one thing that they can do, and they can be specifically very helpful in that area. We now see, grandchildren who can drive can come pick up clothes and take them to the dry cleaners and bring them back, and so everybody can get involved. I really think it takes a village, because no one person is probably going to be able to do everything for every family member that needs care, depending on each family's situation. And so again, I think it's being very specific, being intentional, bringing it up, talking about the elephant in the room. Mom is getting older. She's not able to do as much as she was able to do before. And so instead of maybe insisting that she do more, maybe we need to be more specific with how we help. And at the same time, respect their autonomy, respect their independence, promote their functionality as much as possible. So if they can still walk, let's go walking. If they like to swim, let's go swimming. If they prefer to read books, let's make sure they have them. Let's get them audio books. Let's, supporting the things that they enjoy, promoting their health in that way and their well-being, but then also being very specific and intentional about the tasks that you can pick up off of their plate and help them in order for them to remain at home and to have a good quality of life. And I think one of the things, you talked about that we probably didn't have time to get into is, how do we age well? And I think how we age well is about the choices we make every single day. And I say to patients that you have a choice what you buy when you go to the grocery store. It is by design that when you walk into most grocery stores, the fruits and vegetables are right there. That's by design. And you should, if nothing else, remember to eat the rainbow. If you can put as many different colors, fruit and vegetables in your grocery cart, and then I say to people, stay away from the aisles where there are things in cans and packets. No good thing coming out of there. That's just a lot of salt or a lot of sugar. So stay away from that. And then go down, get your laundry detergent, your dishwashing liquid, and leave the store. And so thinking about eating healthy, that's a choice you can make every day. Eat healthy, drink lots of water, sleep well, exercise. If we can make those choices in our 30s and 40s and 50s, then we're going to get into our 60s in good health. You know, if you're smoking in your 30s, quit smoking, because you know that it's going to have bad effects when you're 65 and older, and now your family has to take care of you when you can't breathe. So, you know, think about what you're doing right now in your earlier years that may be impacting your health when you're older. And, you know, I would like to, you know, finish my comments by saying the best gift any one of us can give to ourselves, to each other as spouses or significant others, and to our families is our best health. And so if you are thinking about how can I age well, make good choices now, make good lifestyle choices now. And as a physician, really, before I actually finish, I cannot emphasize enough age-appropriate healthcare. And so, if you know, get your colonoscopies on time, go for your breast cancer screening with the mammograms, go on time, get your flu shot, your COVID-19 vaccines and boosters. You know, do the things that you can in your power, you have in your power to do to protect your health and promote your health. And that way, you are now giving yourself and your family a gift of an older person that is easier to take care of.
Excellent. Excellent, excellent, excellent. I could just say amen, amen, amen to all of that, Dr. Ivy. And I'm soaking it in because I have good genes, but I have to be a good steward of this
Exactly.
body, right? I only have one, and I got to do all of what you just said so I can age well. And then in that sandwich generation, take care of those aging. My mother-in-law and I have been spending a whole bunch of time together, and she can run circles probably around me because she keeps her mind active and she walks and she makes sure she's doing a lot of what you just said with those various checkups. So we have to be intentional, but we also have to have the conversations that we need to have with our loved ones. So thank you so much for being with us. We will unpack some of the other critical conversations around memory loss and what's the difference between dementia and Alzheimer's and all of what that brings to our lives and the beauty of all of it, because it is what you choose to do and how you choose to live your life. Thank you so much for being with us this afternoon, and we will see you in 2 weeks.
Thank you so much for having me. It's been an absolute pleasure, and I'm looking forward to seeing you in 2 weeks.
Bye-bye. Have a good one.
Thank you. Bye-bye.
What a powerful conversation. What great information and nuggets for us to take with us. Dr. Ivy is going to be back with us in 2 weeks, and we're going to dig deep into memory loss and what all that entails. So please call a sister, get your family members, your partner, your husband, your significant others with you on 2 Sundays from now, the 5th Sunday, where the Sistah Covenant will talk more about this empowering conversation. And we'll even talk to our younger generation and explore the conversation around generations as it relates to caring for our aging parents and living well. So, as always, my sisters, you are bold, beautiful, brilliant, and brave. Be safe, be vigilant, and be blessed.